All right, y'all. I'm back with some more insurance information. All right. Something I ran across earlier or later last week, which threw me for a loop, was I found out that United Healthcare actually has a dual complete plan. Okay, these are similar to the AmeriGroup plans, which were absolutely amazing, by the way, who had your skilled insurance first, your primary, and then they had a Medicaid secondary. These plans are designed for people who are eligible for both Medicare and Medicaid. They provide benefits that are different from traditional Medicare, and these may work for some people. Where they draw people in is where they provide credits for groceries, over-the-counter items like transportation to appointments, maybe some dental, vision, a little prescription drug coverage. And here's the thing, for the United Healthcare Dual Plan, you have to be eligible and enrolled in both Medicare Part A and B and Medicaid. All right. Now, again, these may work for someone. I'm not a fan of Advantage plans, but I also feel as if it's my job to be honest with people. Okay. So if you don't have a lot of health issues and not a lot of money to spare, and these may work for you, I don't recommend them, but here they are. All right. So added benefits may be, again, we go back to the food and over-the-counter credits. They'll give a monthly credit. I've seen some seniors get around $150 a month to take these plans. Now again, it takes some choices out for them regarding providers and those type of things. Dental and vision, there's allowances for like frames and contacts regarding vision. Transportation, I don't know exactly how it works, but they do provide rides to some appointments, pharmacies for medication pickup if you can't get them delivered. Telehealth is a $0 copay for virtual medical and mental health visits. They have health programs like for healthy food and other healthy living type things. Again, those are just some of the things. Here's the problem though. In the event that you need something like home health, there's not really a lot of assistance for you. And someone may argue that with me. However, I actually tried to help a patient that had one of these plans last week, and I couldn't help him. My competitor couldn't help him. And then I actually called another competitor who said, you know what's funny about these is we hadn't heard from them. We haven't heard about them. And United Healthcare actually contacted this home health agency directly to ask them if they knew of anyone that could take it. Why would you launch a dual plan when you don't really have any contracted providers? So keep that in mind. Okay, I gave you the benefits, so I gave you the pros, even though someone in the insurance industry is going to come for me, it's fine. I'm used to it. But there's cons to it. You aren't going to get the benefits that you get with some other plans, and there's also not going to be really any providers that take them. I didn't know anything about them until last week. You have a good day.